Hey folks, good morning. I got to wake here in a few minutes. I'm RFG in for BKP. We're here in downtown, beautiful downtown fall afternoon, fall morning in Blue Ridge, Georgia. Here at the equally beautiful Sycamore Crossing. We will be. This will be our Friday home until we just can't stand the cold temperatures anymore. But right now it's probably about 55, 60 degrees, something like that. It's going to get warmer. We've got a lot going on in North Georgia, as everybody knows, in the fall. Gilmer County has the Apple Fest starting this weekend, and it'll continue into next weekend. Next weekend in Blue Ridge, we've got Art in the Park, which is always a huge event for the Arts Center. Following that, we've got Paws in the Park, and this year we'll have our dock diving championships over the 2 days. That's October 19 and 20, I believe. So we're going to have I don't know, Chris, I don't know if we can do it in 2 hours today. We might need to go 3. I got so much stuff going on. I know Dr. William Whaley's here with us today, and he's locked and loaded, ready to talk about the Ask the Doc segment. We're going to have the all-star panel. We may have somebody new jumping in with us this morning, but Bruce and Jane will be here for sure, keeping me on the straight and narrow. Brian has had an interesting couple of days. He is in Lehigh Valley in Pennsylvania with his family, and he has also been with our own U.S. House of Representative Doug Collins. Doug is there in Pennsylvania to help President Trump win that state again in 2020. As everybody knows, Pennsylvania will be on the short list of states that need to be won if we're going to retain the presidency. He was with him during the day yesterday for some business roundtable discussions. We'll talk about a little bit more with the panel. I don't want to take all the time now, but we'll go into that. And then we'll have the all-star panel. Like I said, we'll have Jesse Barton in here from Cameron Hall, and then we'll finish the show with the Pet of the Week from the Humane Society. So we hope you stick around. We've got Dr. William Whaley coming in for our Ask the Doc segment here. And Chris, if you'll take us to a short break, we'll be back with Ask the Doc, brought to you by Northside Cancer Research Specialists, affiliated with Northside Hospital.
Ace is your helpful place for paint and home goods, tools, outdoor living, and lawn equipment. But did you know Ace Hardware of Blue Ridge is a little bit more? We have hunting rifles and accessories for your next hunting trip. We have Amish furniture imported directly from Ohio. And we have Ace Custom Woodworks for all your custom wood project needs, from cabinets to artwork. Ace Hardware of Blue Ridge. We have your new house in stock.
Hello, my name is Chad Watkins. I'm the manager at Larry's Body Shop. We are a family-owned and operated business and have been serving the North Georgia area since 1978. We are located at 1216 Progress Road in LOJ, Georgia. Our shop specializes in collision repair, and we work with all major insurance companies. Larry's Body Shop is ICAR Gold, the highest role of training recognized by the collision repair industry. It is estimated that only 10% of collision shops meet these standards. Our shop consists of state-of-the-art equipment such as laser measurement system, down-drive spray booth, spot and MIG welding equipment. All of our paints are mixed on-site so that we can guarantee your paint to match every time. I know that having an accident can be a stressful event. We take pride in making sure our customers are satisfied with the repair of their vehicles. Our waiting area is clean and comfortable with free Wi-Fi and refreshing beverages. So if you're in an accident, stop by and see us at Larry's Body Shop.
Do you feel like healthcare has become too impersonal?
8 times an hour, I'll get you in, I'll get you out.
At Lifetime Medical Center, you're more than a number. We get to know you, not just your medical issues. Dr. Alana Kent is board certified in family practice and offers same-day appointments. She and her staff treat conditions from minor to chronic issues. Lifetime Medical Center, convenient to Jasper and Blue Ridge.
This may sting a little. North Georgia Diamond is your source for diamonds in North Georgia.
Hey, good morning. Back again. RFG in for BKP this morning. We've got our famous Dr. William Whaley with us
Y'all
this
always
morning.
done WHW? I mean, what
Yeah, that's right. You could be WHW. We just go by initials.
That's awful. Listen, I got to tell you, I know you mentioned that you might have a guest today. I hope the guest is here because this is a world, I'm not kidding, but a world famous medical consultant. I mean, with millions of lives that he's been in charge of.
That he's touched, yeah.
Well, I mean, he's been in charge of insurance and stuff that, none of us understand, and consulting for millions of people. And
Yeah, he spent a lot of his career on the business side. Didn't he?
well, half of it, 20-something years.
Yeah,
I mean, the guy's a genius. Anyway, I hope he shows up.
I hope he
'cause
comes too. Yeah, it'll be fun.
He's got some good ideas.
Yeah.
He'll
get into the political mix. Anyway, this is our Ask the Doc segment. Good morning to everybody. This is brought to you by North Georgia Cancer Research Center, associated with Northside Hospital. We've got 2 questions out here today.
We got a really good, interesting first.
The first
question.
one?
Yeah,
First one?
And since you've got so much education, you can read it because you can get all the words. All right, go ahead.
Okay, the first question is, my mother is 70 years old and has been getting more anemic each year and has not responded to iron, B12 or vitamins, and the GI doc, the gastrointestinal doctor, says she is not bleeding and she needs to see a hematologist. Is that necessary, and if so, why?
You got to admit that whoever wrote that question answered the stuff we really want to know, right? We want to know age, we want to know sex, we want to know as much background as we have.
Right.
So,
prior treatment?
Yeah. So this then, put up that first thing that says myelodysplastic syndrome, and then we'll pull it back down. You got that up there? This is going to lead us to a disorder called myelodysplastic syndrome, which scares people to death because if they Google it, they see where it says pre-leukemia. All right? So take that off and
correct me if I'm wrong. Myelo means muscle, correct?
No, means bone marrow.
Okay.
Bone marrow. Myelodysplastic. That means bone marrow.
Got it.
Yeah, dysplasia. All right, go to that next one. Now this is just a regular old, mama doesn't feel good. She's fatigued, she's pale, energy's poor, and that everybody knows. Low blood, right? I mean,
sometimes there's a rash that accompanies it too, right?
But those are called petechiae. That's if your platelets go down. But,
yeah.
So first thing we're going to talk about is the mechanisms of anemia. So we're not going to myelodysplastic syndrome yet. But if you reach in your pocket, I love this analogy, and there's no money in there, you got 3 ways you got no money. You didn't earn any, you spent it, or you lost it. That's it, right? So medicine is really easy if you think about mechanisms. So anemia is either low production, I'm not making my red blood, I'm destroying it, I'm making it, but I'm killing it off inside somewhere, or I'm losing it. That's it. Production, destruction, and loss. So the most common we have is loss. Females under the age of 50, multiple pregnancies, menstrual cycles, and so forth. If you can't be iron deficient in this country without GI bleeding, and that's why the GI guy's already involved. He's scoped them, so forth. So the common things about anemia. Let's go to this next one here because it's a really good picture. And you got the one that says microcytic and goes across there with the 3 red cells here. Isn't that a pretty picture?
It is.
That's what everybody's seeing, all that pretty picture there. Well, anyhow, so basically, all of these talk about the size of the red cells, and unfortunately, that is what the family doc sees when he looks at a report, is anemia, and they're going to say he's got big cells, normal cells, or tiny cells, and he's going to get then to thinking about, I hate to see picking fly feces out of pepper, but his mindset's not going to be on production and destruction and loss. So what we see, you can take that down there if you want to for a minute, so that nobody's bothered trying to figure out what thalassemia and reticulocytosis means. Yeah, we don't want to confuse the world here. But this type of anemia, before we understood the mechanisms of it, when I was in medical school, was called refractory anemia, either with or without an excess of blasts. What does that mean? It means anemia that doesn't respond to liver shots, which was what you did before B12, doesn't respond to iron, doesn't respond to anything, patient's not bleeding. So in that category then, we didn't have any idea what was going on. And the only treatment that you could do in those days was to give people transfusions. Well, you can't transfuse people, forever, because the more units of blood you give them, the more opportunity they have to make antibodies against the antigens, and then they can have a reaction that doesn't work, doesn't last. And the average life of a red blood cell is 100 days, right? So that's why you can draw it off, put it in a bucket, and send it off to Afghanistan for some poor soldier who's been wounded. But by the act of taking it out, putting it in a jug and mailing it somewhere, you cut that lifespan from 50 days, which would be the average, down to 2 or 3 weeks. So you give somebody blood, it doesn't last for very long. So anyhow, that over time, and I've been around for all of this time, they began to discover. Let's go to that. Stick with that one for a minute. So the type of anemia that this patient has will be generally associated with not only a low red blood cell count, but a low white blood cell count and a low platelet count. So all 3 of the blood cells in the body will be low. Now you can show that next one that's got the MDS and myelodysplasia on it. You beat me to the punch.
I'm sorry.
That's all right. You're talking about the rash?
Yes.
All right. So you easy bruising and bleeding, and then when your platelets go down, you get these little bitty spots I think you were talking about. These people that have this type of refractory anemia also have an increased possibility of infection because the white blood cells are down. They're fatigued because the red blood cells are down. And they're at danger of bleeding because the platelets are down. You got it?
Mm-hmm.
All right, so go to this next one. I hope we got the next one. So here's the get rid of that guy with the big old arm, and let's go to that last one. It's got the bone in it. You got the bone? Myelodysplastic with the bone of the bone marrow. All right, so here we go. This is actually not a disorder of the red blood cell. It's not a disorder of the platelet. It's not a disorder of the white cell. Now this is really, you got the modern fake stuff on TV where they talk about going and getting stem cell therapy. Well, this is really stem cells. So in your bone marrow, there's the myelo. In your bone marrow, you have seeds. Those seeds are stem cells. they divide into cells that are going to become platelets, going to become white cells, going to become red cells. And the disorder in mama's anemia here is a stem cell disorder that has nothing to do with vitamin B12, liver shots, iron, has nothing to do with GI blood loss. And that's why she needs to go to a hematologist.
It's the inability to produce the seeds that make.
Well, the seeds are there.
The seeds are there.
They're just dysplastic, like this stuff,
Okay.
like these sun-damaged skin.
Right.
That's dysplastic, meaning that they are not dividing appropriately.
Okay.
So they're not growing like they should. Now, you need the hematologist first. He's going to do a bone marrow. So if you don't have any Volkswagens on the street, you got to look in the factory. Are they producing them? So the production is the first thing. You got to go to the factory. The factory is the bone marrow. You'll come in our office. We'll take a bone marrow. You'll go down to the hospital and they'll do it. They'll sedate you if you do it at the hospital. We won't if we do it in the office. But anyhow, so then they'll get the bone marrow.
Where is that? Where physically is that pulled from?
The biggest, thickest bone in the body is this big pelvic bone.
The
that
coccyx?
in people who are the
pelvic.
The pelvic bone, right lateral to the sacroiliac joint. The iliac bone is that big, huge bone
Right.
in there.
Okay.
That if you're not too, even if you're overweight, if you stand and look at an overweight person, you'll notice a little dimple on their back there. That dimple is right over that spot, and it's
Okay.
the closest place to the surface of the skin. And you can take a needle that long and stick it in that bone, because that bone, even in little thin people, is about that deep. So
Okay.
it's safe to do back there.
All right.
And there's not a whole lot of nerves back there, so
Right.
it doesn't hurt like it would
Yeah.
somewhere else. So you take a bone marrow, you look at it, then this becomes a microscopic thing, as you'll notice that the bone marrow itself doesn't have the mature cells. Generally in a bone marrow, you see the young ones, you see the babies, you see the toddlers, you see the preschoolers, you see the college kids, and you see the old ones. And the old ones get dumped out into the blood. There's
There
our
it is.
train whistle.
Sounds of the city in the
Sounds of
morning.
city.
Yeah.
Big Budweiser beer truck next. So, that's the horn and the button and the bell.
Yeah, they're
So
getting ready
anyhow,
to
so now
fire it up.
you go to the
Yep.
the hematologist. He does the bone marrow test. He sees the dysplastic cells. Then he sends that off for a very expensive genetic test to look at what genetic events caused it. Because, as I said, historically it was called pre-leukemia. And a number of these can develop into an acute myelogenous leukemia, which is very difficult to treat. And if it occurs in people who are, the average age, if you look at those slides, is 70. The average age of onset 70. This patient was 70. And so if you look at it, the people that have it generally are between 65 and 75 or 60 and 80, with the big peak right in the middle at 70. So this was the right age person. They have the right history. It's been a long history if you listen to it. Now when you go in there and you see these dysplastic cells, the hematologist will decide whether or not, we've talked in the past about the Lance Armstrong shot to
Right.
build up your red blood.
Yep.
In this situation, frequently just the Lance Armstrong shot to build up your blood will bring the anemia up to a level where the symptoms go away. That's totally safe. You don't have any side effects particularly from it. It's a nuisance because every 4 weeks you got to go to the doctor's office to get a shot. But that's the way the majority of these people are treated. Now, if it happens to be the white blood cells that are the worst and they're low enough for you to get infected, we've talked before about that TV ad where the person has that on-body thing for chemotherapy and it keeps your white count up after chemotherapy. Well, you can get that same shot for the low white blood cells in this disease and get that white count up to where you're not infected. So you've got the opportunity then for either treating the red cells or treating the white cells, and generally that works for most people. Now, I have in my practice a guy I saw yesterday, he's 92 or 93 years old, who's gotten to the point where he has to be transfused about every 3 weeks because those cells run out, those stimulating things run out of effect after a while, and then you have to pull back and change to something else. So to go back to this, go back to the question. This is a 70-year-old woman. She's clearly long past menopause. The gastroenterologist has worked her up. The family practitioner has been treating her with B12 and vitamins, that means folic acid and iron, and she has gotten progressively worse over years. So yes, send her to the hematologist. Probably the bone marrow is going to say there's myelodysplasia. Hopefully it's not myelodysplasia that's gotten as far as leukemia, and hopefully Mama will respond to the Lance Armstrong
That's
Barry Bonds
that's
shot.
not the same as blood doping, though.
Well, if it was Barry Bonds or if it was Lance Armstrong,
It'd be
the
a
shot
different-
would be blood doping. But no, in this it's
With the Lance Armstrong shot, is a little bit different than.
no. This is the Lance Armstrong shot.
Okay.
But the Lance Armstrong shot took Lance Armstrong with a normal red blood count,
Right.
and drove his red blood count up high so that he could catch more oxygen and ride faster.
And let me ask you something. Theoretically speaking, then, if this 92-year-old patient that you've got,
Yeah.
if he were able to continue, if there's some kind of a fountain of youth to keep that stem cell producing those three seeds that
Yeah.
he just.
Yeah. Well, look at George Burns.
Yeah.
He ran out of gas at 102, and it wasn't myelodysplasia. This man's stem cells have been beat to death because
Okay.
he went through all that period of taking the
I
shots.
got you.
And now they're just old. I mean, he's going to be transfused until the Lord takes him home with something else.
Doc promises something interesting. That was a good segment, I thought. That was a good question.
Yeah, I
think
thought
you
so,
covered
too.
it very well.
Well, I like the idea that somebody's talking about something that wasn't cancer, asking a question about anemia.
But
and,
the
and
next
they
question-
they wrote it right.
Yeah.
They
But
wrote
the next
right.
question will be about cancer. And
All
this,
right. All right, let's go to
again,
that.
these segments are brought to you by North Georgia Cancer Research Center, associated with Northside Hospital. If you have any questions for the docs, send them in to info@fetchernews.com. Put in the subject line, ask the doc. Our general manager will look at all of those and see which is the most relevant for Dr. William Whaley to respond to. And secondly, and our final question.
Yeah, and as much
Yes, sir.
information as possible.
Yeah.
Age, sex, history, and background. Go ahead.
Right. My sister is 60 and has recurrent breast cancer all over her body. And the doctor wants to treat her with hormones and not chemotherapy and not the new immunotherapy.
You did it. You got the word.
Is immunotherapy.
Yeah, our BKP would have had me read the question.
Hamada. Is this proper?
Great question, because we've been talking so much in the last year about the Jimmy Carter treatment with the immune treatment, and everybody's focusing on immune treatment. And the way this question is written, it's like the writer thinks Mama isn't getting the modern treatment. The doctors just wants to give her, athlete's foot type treatment or something. And it's written in such a way as, is Mama getting the state of the art treatment? Do you read that way?
Exactly. Yeah.
Okay. Right.
Yeah.
Throw that first one up. Hormonal therapy for breast cancer. You got just the plain one. First of all, you'll remember we talk all the time about markers, right?
We do.
We talk about PSA, right? And we talk about the fact that when we're treating cancer of the prostate that's recurred, and we give you a shot once every 6 months, that all that shot does is stop you from making testosterone. The testosterone level falls and it quits feeding the prostate cancer. Now, we've talked about that on here a lot
Several
of times,
times,
well,
yep.
because all the guys are sitting up here men.
Right.
All right. So
Yeah.
now, hormonal therapy for breast cancer. That's the topic we got today. Pull that one down. And then the next one says hormonal therapy for the treatment of metastatic breast cancer, meaning it has recurred. Quickly enough, when a patient has cancer of the breast today,
Wait,
if
that's an important point. When you hear the word metastatic breast cancer,
it's spread,
that means that it's spread or it's come back.
it come back, right?
Okay.
It's elsewhere. So, but when you have breast cancer today that has not recurred, that is just in the breast itself, It has now been operated on. The lymph nodes have been sampled. It's not big enough to require chemotherapy, and it's sensitive to estrogen. Then for 10 years, those patients take a drug which blocks estrogen to prevent recurrence, all right, to prevent recurrence. That same drug will diminish by 60% the chances that you will get a breast cancer in the opposite breast. So that's hormonal therapy for non-metastatic primary cancer of the breast. So now we're going to get to this patient. Okay, take that one down. It's got the spread of breast cancer picture up there. So now the story in this one is, this patient had a breast cancer. From listening to the story, this has been a number of years since she was treated, right? And the cancer has showed up in different parts of the body.
It metastasized.
It metastasized. Now, generally it'll get into the bloodstream, and it can go to bone, liver, lung. It gets into the lymph nodes. It can go to the lymph nodes in and around the chest. Now, did you ever find that picture of the bone scan? All right, pop that next one up there, because this is exactly what this patient's talking about. You got that bone scan up there? Now, this may be a little bit different. On the left-hand side of what they're looking at there is a radiographic picture of a normal person with a bone scan. They have given that person a calcium linked to a radioactive isotope that goes through the entire body and goes to the parts of the bone that are metabolically more active. Well, if you look at this, it's not, you don't have to be a scientist to see that the guy's ankles and his knees, you know, they're going to be a little inflamed, right?
Mine are going to be metal.
You'll be okay, all right. Now, the main bone marrow that makes bone is all in the spinal column. You see where those two dark places are
I
there
do.
in the pelvis? That's where we did the bone marrow on that
Right.
last patient. And this is totally symmetrical. Now, if you look at the one next door to it, you notice all these little hot spots in different spots, different places?
Yep.
That is exactly the bone scan of patient with metastatic breast cancer in all the bones of the body.
Is that
And
also referred to as a PET scan?
No, that's
different.
PET scan's different, but it's the same concept and the same lit up stuff. It's just done in a different fashion.
Okay.
I have had patients, and I've seen them in the last week or two, that appeared 20 years ago on a stretcher in the office with every bone in the body eaten up by cancer on morphine. All right? Treated with hormonal therapy alone, and they're out there playing pickleball and have been out there playing pickleball for 20 years with various hormonal therapies. Now, what that'll tell you, let's go to the next one. Generally, in that situation, you got a whole thing here, but it lit up at the bottom. What's that say? Pretty good sized word there, but what does that say?
Postmenopausal treatment.
Ah, all right. What did we hear about this woman? How old was she?
60.
Oh, well, 60. I don't know a 60-year-old woman yet, not after menopause.
Exactly.
Okay. So, if this patient had her cancer high in estrogen and was not taking estrogens in that first 10 years that I meant to reduce recurrence, and has good liver function, it's not in the lungs, do something to relieve the pain, start them on hormonal therapy. You'll remember we've talked in the past about the drug that Sally Fields talks about, the osteoporosis we use to stimulate, to stabilize bones. That's separate from the hormone, but it's an easy thing you take every month. Within 60 days, this patient's calcium can be normal, the pain can be gone away, they can be out of the bed, and if you're doing hormonal therapy alone, it doesn't have any sort of a sunset provision in it.
Right.
Now, you remember when we take chemotherapy, we're generally talking about 4 months or 6 months of chemotherapy, and then you got to stop because we're kicking ass and taking names,
Yep.
right?
Mm-hmm.
And if we're using Jimmy Carter's immune therapy, after you've taken it for 2 years, you're at such high risk for immune lung disease and colon disease and stuff, you got to stop. So all of these miracle treatments we talk about that snatch people back from the brink, they have sort of a sunset provision in how long you can safely give them. Well, these hormones you can give 20 years. It's just like one of the questions we're going to get to when we're talking about the news in a minute. It's like a woman that's postmenopause taking estrogen. The side effects of this treatment that we're talking about here are hot flashes. Well, what postmenopausal woman had never had a hot flash? I mean, basically...
I don't know any, do you?
Basically, the hormonal therapy that we're talking about giving this woman in place of chemo or immunotherapy, the side effects are she might have some hot flashes, and she can be treated for 2 years, 5 years, or 20 years with a series of hormonal treatments and remain in remission. Are you still with me?
I am with you.
All right, we're gonna blow it in here and come to.
I'm with you.
We're gonna end on this in a minute.
All righty.
We're gonna get to the news in a minute. All right. So this last one, you got the emerging sequence thing here. The reason I says it doesn't have sunset in it is that you've all heard of tamoxifen. That's the common drug that was first came out of Betty Ford time. I mean, how long ago was that? As an anti-estrogen drug, had a certain way of working. We took us years to figure out that there are other steps that you can get into that will block estrogens in other ways. So one of the reasons that there's no sunset provision in how long this can work is you might start with the oldest drug first, which is exactly what you would do. This drug's probably $20 a month at the Walmart pharmacy, and it's not expensive. It might work for 1 year, it might work for 10 years, and then if it loses its effect, you'll notice they got second-line hormonal therapy, not important what it is. There's third-line hormonal therapy, not important what it is. There's fourth-line hormonal therapy. Well, that means that you can go through a whole series of these arrows in your quiver in the hormonal line, and it can last decades. So I think your mother...
Is that slide still up, Chris? Tell us what ER positive
that
means.
The estrogen receptor
Okay.
is on that cell. Remember I said way back at the first, that cancer cell has to have a receptor for estrogen on it, which most postmenopausal breast cancers do. We've talked before about triple negative breast cancer, at the fast growing kind. Well, this ain't going to work there.
Okay.
It's negative for the estrogen receptor.
I'm assuming that if it had the ER positive in front of it, that means there's other types of advanced breast cancer as well.
Yes, that are not ER positive. But they're the minimum.
Right.
A triple negative one, we're on the chemotherapy and we're on the immunotherapy or something.
Got it.
So anyway, the point about your mama is she's getting great care, and listen to them. They've got arrows in their quiver back here.
They might have only used one, but they got several more.
Right, yeah. Well, they might use the hormones for 20 years, and by then, who knows what we're going to have.
Yeah.
But if those run out, the chemo's still back there. So Mama's getting good care. Don't lose any sleep.
Don't worry about it.
Don't worry
Mama's
about
getting
Mama.
good care.
Right, and where
Mama,
we're
don't
only
let
Mama.
your babies grow up. Anyway,
Don't
it's
let
always fun to have Doc with us this morning. We've got sponsored by North Georgia Cancer Research Center, associated with Northside Hospital.
That's a lot. That's a mouthful.
That's a
isn't it?
mouthful, yeah.
Yes.
But
the Cancer Center at Northside.
there you go.
All right. Well, let's get in. You ready to get in the news?
Well, we're going to get the all-star panel in here. We do have our special guest with us.
We
this
do.
morning.
I saw him pull up just a
he
minute ago.
pulled up. And
We've already told about it.
Yeah.
All
He's,
right.
yeah. So anyway,
All right. So we're going to get into the.
here's our famous fact of the week. What is pressing in the news? And
Okay,
we've probably covered it already.
Nope.
Because he is cutting edge, folks.
All right. Well, here you go. First one is I'm always complaining about the people and their cell phones and electronic games, right? The first thing in the list this week was smartphone slouching causing permanent and serious skeletal issues. Neck, shoulder, back. And guess what? The average amount of time that not adolescents, but adults in the United States today are using with electronic equipment
Per day?
per day.
Man, I'm telling you.
Man,
Maybe
that's-
6?
Well, it's 3.5.
3.5.
Now,
I'm not 6.
You've already done an hour since I've been here. Okay. So we'll get rid of that. Okay, the big thing about the news is, and this is really quite interesting because this comes up all the time, 2 things that people should be interested in. One, married people in the last 7 years, I don't know if you saw this or not,
No.
have a longer lifespan than the unmarried or divorced. So in the last 7 years, their lifespan has gone up by 14% compared to the never married or the divorced.
Why?
I'm going to get to that in just a minute. The worst is widowed. Their lifespan has gone down by more percentage points than the difference between the never married and the divorced. Now, why would that be? Now, part of this you ain't going to like. Part of it may mean that you've got a mate that bugs you to try and keep you on healthy behaviors. In other words, takes away your donuts or limits your alcohol or tries to get you to exercise or something. So maybe it means you got a nagger in the house that's keeping you on a more healthy program. That's one possible reason.
All right.
Second is the married probably have a better income, and therefore they're more likely to be able to afford health insurance, and they're more likely to be able to afford recreational activities. So there are things about the act of marriage that may improve the infrastructure and the lifestyle such that the life expectancy is longer, and the bachelor, the forever bachelor, and the divorced man who's been divorced longer than a decade, it's amazing how much less their life expectancy
And that
is.
study just came out?
Yeah, it came out yesterday. And by the way, it's I've forgotten. It's like 29,000 or something, some big number.
That was
like
the sample?
Yeah. Now the other one that came out is, and I love this one, early menopause is associated with a significant increase in cardiovascular disease and stroke. And this was one of those studies like they came up with about the beef a few weeks ago, where they took tons and tons of studies, so it increased. That beef study was, 14 million people when it was all added together. This is about 300,000 menopausal women who've gone through menopause at different points, from 40, 50, and below. Okay, so here's what they learned. That early menopause increases the risk of cardiovascular disease and stroke, totally separate from any other risk category, whether it's obesity, cigarette smoking, or anything else. Totally, when does the menopause come on? So now, we've been going through this for years. People say, well, is it safe to take hormones? Is it safe to take hormones? And I've always said, absent a history of thrombophlebitis, or absent a history of certain hereditary, strongly hereditary cancers, the hazard-benefit ratio for women postmenopausally is to take a hormone. Well, that then obliterates this earlier death from the early menopause. And so this is why is
it contraindicated for phlebitis?
Women have thrombophlebitis when they get pregnant,
right,
take birth control pills,
right,
and hormonal therapy in people who have a predisposition to clotting.
Okay,
they have
so
to have
it exacerbates that.
Yeah, exacerbates. Okay. So anyhow, the point I'm making is that this is what you call an epidemiologic study on the natural behavior of people who went through menopause. But if you take it and think it through, it's another one of those things that says hormonal therapy probably is a safe bet given the proper choices for patients, that you're not giving it to somebody who's had 2 clots in the leg or a clot in the lung.
Gotcha.
There, that's all I got for you today.
Cutting edge stuff all
Nothing,
the time.
Hey, you didn't hear a word about flu shots or Shingrix shots today.
We got a quick question from the peanut gallery.
What's considered early menopause in women?
Average age of first menstrual period is 12. Average age of menopause is 52. 7 years early is 45. So 45 or below is early menopause. Very good.
One more question.
One of the advantages is it prevents pregnancy.
That is a profound statement that we will close on, as always.
That's from your guest.
We'll have more from our guests, the All-Star panel, here in a few minutes. Thank you. That was great.
And the beer truck's there.
Beer
See?
truck's here. So libations are forthcoming. Got a full day?
Yeah, dude.
All right, man.
Looking forward to the weekend, though.
All righty.
Hope to get the
It'll be a good one.
Yeah, it will be. All right.
All righty. Chris, take us to break, brother.